Okay, so your patient comes to you and tells you, my toxin didn't last, my treatment that you gave me didn't last. So let's have a look at the things that might have an impact on that. For me, the single biggest determinant of longevity with any patient is the dose given at initial treatment. I think other individual factors then play into that, and I think patient perception about what toxin does typically plays a big part in that. But let's break it down and have a look. I mean, we hear all sorts of things, don't we, in kind of media, what patients say and this and that. And I think for me, the greatest impact on toxin longevity is as simple as the dose used at initial treatment. Basically, the higher the dose, I think the greater the initial intensity of effect, and also then the greater perception of increased longevity with the patient. So we all know typical treatment's going to last 3 to 4 months. I think, is it 3, is it 4? I think a lot of that is determined by the initial dose that's given rather than anything else. So you hear things like, people who exercise, people who have, certain diets and doing things with their lifestyle. I mean, people say this, but there's nothing in the literature that kind of suggests or tells us this definitively. I think the biggest determinant of longevity with toxin is simply the dose.